We've discussed what the difference between a new patient and established patient, right?
Mhm.
Remember that key about 3 years?
3 years, within 3 years or something?
Depending, I like, but there's,
Birthday? No.
Talking
New patient
about,
patient who has not seen a provider within the past 3 years is a new patient.
right,
Oh,
so an established patient is someone who's been seen within the practice within the last 3 years. A new patient would be a patient that has not been seen within the last 3 years, right? Okay. We also talked about how important it is to have patients update their information,
Mhm.
right? So you can make sure you have the correct insurance and contact information to get a hold of them for billing purposes. We've talked a little bit about what non-PAR and PAR means. Do you guys remember what PAR stands for?
Participating
Right.
Participating provider.
PAR is participating provider, non-PAR is non-participating provider. When is it okay to release protected health information?
When a waiver has been signed,
What would they sign a waiver for?
they would sign it for either court, medical documents, let's see if you're subpoenaed. With your medical documents, the doctor is okay to release that information in the court setting. It's okay to, like, if it's to another doctor, as long as you don't tell, like, names, race, stuff like that, if you're consulting a fellow physician
Right.
for information.
If you're
There you go.
If you're sending it to another doc for treatment or for
Mhm.
consultation, maybe to the insurance company for payment,
Mhm.
right? Uh, Are children allowed to sign HIPAA forms?
Yes.
No,
No,
Oh, no?
unless they're emancipated.
right. Children are not allowed to sign their own name. They have to have a parent or guardian sign.
They can sign the form if it says patient, but then it should also have a spot like parent guardian, like when you're dealing with children's
Right.
illness forms and whatnot.
Or if they're in the emergency room, right?
Mhm, mhm.
Now, one of the things that we've talked about, which I want to make sure you guys are clear on, the notice of private practice, acknowledgement of receipts of notice of private practice. Remember, that's a form that a patient signs that says they understand about their information and how it's protected. Does a patient have to sign that form?
No.
No. You can treat a patient without them signing that form, okay? They should sign it. They are not required to sign that form, all right? We talked a little bit about when you send off information, so like an insurance company to see if somebody's covered, under HIPAA, they attach tracer numbers. You guys remember that, like that X270?
Mhm.
And
It's
then-
usually X12 something.
Right, and then when they send the reply back to you, it has a tracer number as well, okay? So
We
you
have
guys,
to know the tracer number
We
is?
have to know them.
Okay.
you have to know what a tracer number is used for.
Uh-huh.
Okay. The birthday rule,
The month.
right? The month, whatever month comes first, if both parents have insurance on a kid, that's the primary. So Phil's is in February, Larissa's is in June, they both have insurance,
Or it's March.
Bill.
it would go with Phil, even though Phil may be older or younger, it doesn't matter. It's whenever the birth month is, okay? If an individual has insurance, well, if an individual has more than one type of insurance, what's the next insurance called? Right, they have primary,
Secondary.
secondary, right?
Mhm.
And
Oh,
if you're sending information about a patient who has secondary insurance, do you send that information along to their primary insurance?
No. You do?
You do.
I thought no, you send the primary insurance to secondary, I thought. They were backwards. Okay.
Does
You
it go
send it
either
to
way?
you send it to the primary, because you always send everything to the primary first.
Well, they need to know, why do they need the extra information about what's going with the money left over? I'm like, all they need to know is what they're taking care of, right?
In the grand scheme, yes, I see what you're saying, but that is, what's a good way to put this?
Tertiary and third.
Tertiary, and then you can have supplemental, if you
Something
have
like that.
something like
Got
that. I don't know, I remember we had this discussion in class on Thursday. And then we quoted right out of the book, but I don't know what page it is off the top of my head. But it's the responsible to let the primary know if there's a secondary. And I think part of that is so they don't,
Overpay or?
well, not necessarily overpay, but send the rest of the bill
Would that be
to,
on 104?
Oh, so they can just forward it straight to
Straight
the
over.
secondary.
Yeah.
Okay, I see, I understand now.
I don't know, I'd have to look,
Oh.
yeah. All right. That's really about it for the quiz. I basically went over the 10 questions on the quiz with you just now.
Mhm.
Obviously not word for word, but the general
Well, we'd hope not.
overview of what you're looking for. Does anyone have any question about tracer numbers or the difference between